I work for Addaction, which is the country's leading substance misuse charity. It is a third sector organisation, but most of our funding comes through public health, and we work with young people from the ages of 10 up to adults, veterans, families, anybody where there's substance misuse issues. I'm currently managing substance misuse services for young people aged 10 to 24 in Liverpool. Social care to me is about supporting people and empowering people to make changes in their life. Particularly in our field, it's around them making changes to their behaviour to improve their life, their lifestyle chances and ultimately their health. In working in partnership with Manchester Met, I've been working alongside Victoria, and she's made it really easy for us to take placements. So what we've done is we've taken students on a placement, they've come in and they've done their hours with us, they've shadowed staff, they've worked with staff, they've attended clinics, they've done some work in adult services. If they're with us long enough, they can potentially have a small caseload so they can put into practice skills that they've learned in college. There's been loads of networking opportunities for us with Manchester Met, which has made things really easy for me as a new person putting student placements in. And it's been really good that we've had someone from social care. We get lots of health, lots of medical, lots of clinical, lots of psychology students, but having somebody from social care, that's a real different perspective, and there's always learning for us as an organisation as well when we're taking placements. I think being flexible. It's a very sort of like changing sort of like workplace. Some days you will have 5 appointments booked in, and given the nature of people with substance misuse issues, none of them will turn up. So you need to be flexible, you need to have contingency plans, you need to be able to plan your work around the fact that sometimes people don't engage as well as you might like them to. But then you also need to have that flexibility to seize the opportunity when people do want to engage with your service, to actually give them the right support, the right interventions. So I think for me, in my sector, flexibility and keeping a bridge of everything that's going on, particularly in the substance misuse world. Drugs change so quickly, there are new psychoactive substances, new laws and things like that. So it's keeping yourself abreast of what's going on in your sort of chosen field. What is great about working in social care is it's different every day. Ostensibly, I work in the substance misuse field, so you kind of think, yeah, it is the same, but it isn't, because everybody's different, people are different, their issues are different, what they present with isn't necessarily the same for them all the time. It changes over the period of their journey. Once people come into us, for example, someone could come into us on a police order, so they've been mandated by the court to come in to see us, and then over that period of time, they'll become more stable, we'll be able to script them, we'll be able to put them into a shared care system, ultimately into recovery services and then into relapse prevention. That's one person that you can see, and that may take 2 or 3 years. In some cases it takes considerable time longer than that, but it's being able to support somebody right from the start, right to the end, and everything being different on a daily basis. It's not a sector where I think you'd get bored. If you like people and you like the way that people are and you like to support people, that's what makes it great. I would say the best piece of advice I could give is to volunteer in a social care environment. The staff that I've got now, probably getting on for 2/3 of them started as volunteers. Predominantly, a good number of those started as volunteers within our services. It gives you that opportunity to learn without having to have the responsibility of a member of staff. It gives you that experience of working alongside people. It gives you that sort of like opportunity to try out your skills. It also gives employers an opportunity to see you and you to showcase what you can do. And even if you don't end up working in that particular field, when I'm doing interviews, I'm always looking on application forms, has somebody done volunteering? It might not even be anything to do with substance misuse, it could be something entirely different, but that experience is something that they bring with them and can use no matter what. And the same as what advice I'd give otherwise is to keep abreast of what's going on. If you're working in a slightly different sector, keep yourself up to date with what's going on in education, or keep yourself up to date with what's going on in health. That way, if something comes up, you're always up to date. That's what employers are looking for, is people who've bothered to keep themselves up to date with what's going on.